Hey guys, my name is Josh Elledge. Thanks for joining me today. Appreciate your time. We'll get into it a little bit, but we're going to talk about nurse practitioner residencies today. Just shed a little light on it, talk about some of the needs and the benefits. So I will share my screen on 1 second. Okay, I hope you can see that. I will get us started. So here we go. Yeah, guys, like I said, my name is Josh Elledge. I am a nurse practitioner with Cahaba Medical Care. And today we're going to talk about nurse practitioner residencies, the need and the benefit. So, this phrase, I don't know if this is my calling. One resident said this to me at one point in time through tears flowing down her face. She was roughly about 4 months into our training program here at Cahaba. Yet the contrast is in her interview, which was about 6 months prior to that moment, she described herself in the following ways, whether it was in writing or her initial interview. She said these things, that she had a passion and a desire to help people. While she was in clinical, she found that she just loved primary care, wanted to address the gap for uninsured populations, and was saying that there's a ministry here in the U.S., not just overseas. So aside from this statement being a disappointment, I think it's actually quite telling about the toll that it takes on a provider in their first year of practice, regardless whether it's a physician or advanced practice provider. And I would actually say that whether I want to admit it or not, this statement of, I don't know if this is my calling, I've actually uttered those words myself before. So I've known for years that I wanted to encourage, inspire, and prepare other providers to administer health care as Jesus would. Yet I can remember, no matter how passionate I was and feeling called to doing that calling, I can remember uttering these words to one of my close friends and mentors. I was reeling under the pressure of the mental, emotional, the physical, and spiritual exhaustion that's associated with working in safety net clinics. It was an 11 o'clock phone call, one of the low of the lows for me. I honestly didn't know which way was up. I was so just reeling on, again, mental, emotional, physical, spiritual pressure. But I'm thankful that I had somebody to reach out to for support, right? It was actually turned out to be a big turning point in my career. Yet, while identifying the struggle with new nurse practitioners, it's not just new nurse practitioners that struggle during this time. So I want to give you a scenario. Imagine that you're a doctor and you're a physician. You just hired a new nurse practitioner right out of school, or maybe you're an administrator. You just hired a new nurse practitioner right out of school. And you're in a meeting with one of your office staff members, or you're off-site, actually, maybe at a CME, or you're on vacation, or working at a different site, or maybe you're actually in your own clinic down the hall, and you get a phone call from one of the LPNs stating that the new nurse practitioner you hired is refusing to go in a room to see a patient complaining of chest pain because that is, quote unquote, out of her scope of practice. The nurse practitioner is actually just even refusing to lay a hand on this patient. And once you finally have determined that this is something you need to commit some time to, you try to walk the nurse practitioner through the visit, yet she's still refusing. And ultimately, the LPN on site, ships the patient off via ambulance to a nearby hospital without an outpatient evaluation. The nurse practitioner still had not spoken with the patient, had not assessed them. This nurse practitioner simply felt unprepared, not confident, nor competent, and she froze in the situation, which caused an issue of care for the patient and a state of inefficiency for the staff. So that's actually a real story. That's actually a true story from my CEO with one of his very first nurse practitioners that started here, one of the first, maybe not the first. And I would ask you guys, wouldn't it be a blessing if not just for this administrator, not just for that physician, for even the patient or the community, but wouldn't it be a blessing if for that nurse practitioner, if they could have adequately assessed and cared for that patient, if they had the confidence, the competence to do it. And so I would also ask, is just as many in this profession believe that healthcare should be a right and not a privilege, that could having a sound, confident, competent provider also be considered a right instead of a privilege? Something to think on. So today, I want to discuss with you the need and the benefit of nurse practitioner residencies, particularly from a perspective of primary care in an FQHC or other verbiage, community health center, or a safety net setting. But first, let's dig into a little bit about my company and who I work for. We are Cahaba Medical Care, and we have a nurse practitioner residency here. So for the past 6.5 years, I've worked with Cahaba, which is actually a 30-site FQHC in West Central Alabama. We house more than 550 employees, roughly, and we have about 80 primary care providers within our organization. In 2021, we served almost 160,000 patients. Had 160,000 patient encounters. I have been the program director for Cahaba's residency, nurse practitioner residency, for the past 5 years, during which we've graduated, thankfully, 18 nurse practitioner residents. Of those graduates, 90% of them are actually still employed in FQHCs across the country. 13 of those graduates, those 18 graduates, actually stayed with Cahaba once they graduated. So roughly a 72% kind of pipeline retention rate there. Potentially could have had more if we had availability in the organization. A little bit about our program. We were recently accredited. We're 15 months in length. Any given week, a resident is seeing patients on their own about 2.5 days out of the week, about half the week. And they have a kind of a progressive ramp up of their schedule over the first 7 months. The rest of the week includes shadowing rotations, precepted clinics, which is similar to family medicine residency, attending type clinic, specialty rotations, and didactics. Didactics are about a half day a week on Thursday afternoons. So that's a little bit about our program, but I would also kind of want to relate that anyone who has worked in a safety net setting can relate to the notion that community health centers and safety net settings are complex clinical systems. They're packed with social determinants of health, behavioral health, as well as substance abuse issues. And this is amidst the already vast breadth of primary care issues that could walk through your door at any day, anytime. So in one study, almost 30% of nurse practitioners indicated they had an intent to leave their position. And another study actually noted that this was twice that of doctors. I was actually not able to find any specific statistics related to the first year of nurse practitioners, the turnover rate in first year NPs. But in my experience with residencies and actually as an APP lead within our organization, working with other non-nurse practitioner residents, I actually feel that those numbers they're actually accurate, or maybe even being a little modest, particularly within safety net clinics, which are quite complex systems. And even worse than maybe just shifting from one position to another or one company to another, some NPs have even been known to leave the workforce altogether in their first year, whether they were returning to their RN role that they felt so comfortable in, or to their non-healthcare jobs, to other non-healthcare jobs, despite their years of education and training. Yet there is an interest for training and support. One study showed that 90% of new graduate nurse practitioners expressed a need for mentoring or even a residency program to improve this role transition. And in another study, 85% said that they would have pursued postgraduate training if it were offered. So this phrase, this quote actually is what I heard from one nurse practitioner. She was a new nurse practitioner, and we had a small debrief. This was actually after she resigned from Cahaba. She'd only been here for about 160 days, around about, roughly half of a year, if my math serves, a little less than half a year. This young lady was missionally minded, passionate, charismatic, quite insightful. And she said this to me: I don't know how you, talking to me, can keep your faith and minister while also still have a family and work in FQHC. And I'm not saying that necessarily an FQHC or underserved care was her specific calling in life. However, the need to not only learn medical knowledge, but also learn professionalism, leadership, role transition, and kind of how to manage this role on a daily basis, to have support there, that need is very present. And for her, it was more than just good medical decision making that caused her to feel overwhelmed. It was honestly balancing everything. And so, actually, in speaking with our CMO recently, Dr. Lacey Smith, on the facets involved in optimal postgraduate training, talking to her about what can we do to make things great, she elaborated on the surprising gap in professionalism skills for second-year NPs. She said that even if their medical knowledge acquisition kind of progresses at an expected rate, if they're doing well in that in their first year of training, said the things that most plagues a second-year NP is more related to the administrative role and the role responsibilities, such as managing their notes, handling messages from staff, delegating appropriately, and leadership of the healthcare team. This, more than a lack of medical knowledge, seemed to overwhelm and create longer hours and higher amounts of stress. On a similar thread, actually, I was discussing this topic of discipleship with an elder, actually from my home church recently. He said to me that really catchy phrase, that the greatest omission from the Great Commission in Matthew 28 is discipleship. And while there's obviously my point here is, while there's definitely a huge difference between postgraduate training and following Jesus, the need for discipleship or training in everyday life, training in the little things, this is a consistent theme in both medicine and our walk with Christ. And training a new provider is more than just about medical knowledge. It's also about that professional role transition. And this requires time and intentionality and somebody walking with you through it. And it's worth noting also that while nurse practitioners in primary care are oftentimes providing about 80 to 90% of the same services as their physician counterparts, they actually receive less than 10% of clinical training. As you can see, the clinical hours here on this slide, there's a notable difference. I personally had about 750 clinical hours through my graduate studies and jumped right into working at an FQHC. And I'm so thankful I was here at Cahaba, where I had plenty of not residency, but support in many ways. The interesting thing from a primary care standpoint is that NPs actually have been noted to be more likely to practice in low-income, high-minority practices, such as FQHCs and community health centers. And even more so, if you were an NP who did a residency within an FQHC, you're even more likely to go back and stay in an FQHC. We've seen this within our own program, with about 90% of our graduates chose to stay in underserved medicine. NPs actually stand to be a real aid to the primary care provider shortage. The NP jobs are one of the fastest growing professions, which are predicted to grow by about 52%, 52.5% between 2020 and 2030. So even here at Cahaba, actually about half of our workforce are advanced practice providers, which is actually in line with the national average, around about that same number. Kansas, interestingly, had the highest APP to physician ratio, with almost 4 out of 5 primary care providers being listed as an APP. almost 80%. So there definitely remains a need for postgraduate training amongst NPs if they're going to be this involved in primary care. Yet, prior to recent HRSA and legislative efforts, funding for postgraduate training programs were essentially non-existent before about 2019. And even now, these funds that have been the grants that we've actually enjoyed here and that our nation has seen, there are time limits on this funding. The upcoming grant from HRSA that actually will start in this summer, it's going to end in 4 years with no guarantee or certainty of renewal. It's really dependent upon HRSA's strategic initiatives at the time. And for various reasons, this differs from family medicine residency funding, which has a storied funding history and has integrated itself into Medicare law in many ways. So the question is, do nurse practitioner residencies actually work? Does this training model actually work? While I think many of those listening wouldn't necessarily argue against the benefit, I think it's worthwhile to look at some of the available literature describing the benefit to the resident as well as the hosting organization. So here's a kind of a word cloud that I thought captured a good bit of the benefits here. In 2018, one study compared nurse practitioner residents to NPs who did not complete a residency. And it was of about 8,400 nurse practitioners responded to this survey. And it was noted that of the residents, residents who responded, they were more likely than their counterparts who didn't do a training program to report enhanced confidence in their independent roles, greater practice autonomy, greater confidence to practice in an interprofessional team. They had an increased job satisfaction and a decreased intent to leave. One program director even stated that their nurse practitioner resident in another study said that their resident far exceeded most new hires who have completed on-the-job training, and even beyond what some other more experienced seasoned providers were performing at, that their resident was performing at a higher level. And another study in 2021, which had polled close to 100 program directors of nurse practitioner residencies, it says that 97% of the respondents reported that their residents had increased confidence and competence as the number one benefit, both to the resident and the organization. There was noted improved communication and collaboration in some other studies, and in multiple actually different studies, communication and collaboration, working with doctors, working with the interprofessional team, it was noted to be enhanced in comparison to non-residency trained nurse practitioners. And as our CEO, who's also a doctor, he's been involved in residency training for more than 20 years. And as he likes to put it, entrustment to give a good report. This is something that is integral, right, in communicating with any other healthcare provider, whether in your company or not. And improved communication and collaboration is critical there, and entrustment to give a good report. They were noted to also, nurse practitioner residents were noted to have an enhanced clinical judgment and showed readiness to practice more than their counterparts. In regards to leadership, nurse practitioner residents, actually 1 in 5 nurse practitioner residency graduates were noted to be involved in or starting or facilitating a nurse practitioner residency. So it kind of suggests a greater confidence for leadership, a greater confidence in doing quality improvement initiatives, giving back to the profession. And one of our residents actually said that the camaraderie proved to be a protective factor for them. And therefore, they all got through, when they were going through their cohort, their camaraderie cohort, they got through their program amidst the middle of COVID just because they had each other. So there's plenty of benefits to their career just having someone else to train around. So I tried to succinctly communicate the various benefits of the residencies on this slide. And as you can see, the literature is actually quite robust on this topic in comparing to non-nurse practitioner, non-residency trained nurse practitioners. So after seeing other APPs enter Cahaba, this is a quote from one of our previous grads. She said, after seeing other APPs enter Cahaba without the residency, I feel there is a noticeable difference in burnout, systems navigation, and expectations. And our CEO actually has advocated, and he jokingly, but also being quite serious, that he mentioned that he wishes all APPs, all new APP hires would go through our nurse practitioner residency. He believes in it that much. In one of the previous studies, surveying the program directors about the comparisons, 90% reported an enhancement in recruitment and an improvement in retention. So this benefits the organization just as much as it does the resident themselves. And I'm sure we're all familiar with the cost of losing an employee. That actually statistics show that it costs almost 1.4 to 2 times that employee's salary, and you have to start all over again. So if residents are showing enhanced recruitment and retention, I think these are great options. Here at Cahaba, over the past 5 years, we have seen actually a 13% higher retention rate between residency graduates and other APP hires within the company. So a 13% more likely chance that they'll still be here if they've actually been trained through our residency. And one quote actually was that residencies give you the skills that you need to survive with longevity in community health. They said, because I'm now nearing my 5th year of practice and I'm still here, the residency gave me those skills. Yeah, here's that quote. I wanted you guys to see that. And another quote from one study that was done, from a qualitative study, that thought this was actually really impactful. I want to put the whole thing up here. It says, I think a nurse practitioner residency or postgraduate training program, it allows us to be part of conversations regarding advocacy and how we can ensure that we're all providing quality services for our patients. As a graduate of the residency, I continue to have an impact, not just on one-to-one 15-minute patient appointments, but on the larger conversation, increasing diversity in the workforce, leadership in nursing, making sure that we have advocacy in nursing, making sure we're present so that our patients understand that we provide high quality services, and then ensuring that the next generation doesn't get eaten by the wolves. This was her comment on the value of postgraduate training programs. So what technically can be done after we looked at the needs and we've talked about the benefits thereof? What are some of the things that you can do? If you're thinking of starting a residency, or you're a student who's looking for a residency, one thing within a company is what was noted in one of the studies is there's an increased workload and burden on preceptors. These were listed as the #1 barrier to succeeding in hosting a residency. And of course, cost was the second highest rated barrier. Preceptors and collaborators, they need time to teach and to provide feedback. This is crucial to optimal resident growth. So addressing that in some way within the organization is critical. Physician support. It'd be good to also ensure physician support and administrative support. These were the #1 and #2 ranked facilitators of residency success. So ensuring that you have this within your organization is key as well. Plenty of doctor support, plenty of admin support. And finally, more funding opportunities are critical. As we mentioned earlier, while funding opportunities have recently existed through HRSA, the funds are limited both in quantity and duration. Lobbying for more sustainable funding for these programs is critical. And I wanted to make sure I highlight this book. 5 years ago, I wasn't even sure when I was trying to build our residency. I've never been a part of one, and I started from scratch. I wasn't sure where to start. So I tracked down these amazing humans, Carrie Bamrick and Dr. Margaret Flinter. They sent me their book for free. It's an amazing resource. It's available online for free. Dr. Flinter started the first residency in the nation back in 2007, the first nurse practitioner residency. And so much of our program is built on the structure outlined in this book. It discusses financial considerations as well as lobbying with organizational stakeholders. I would highly recommend it in your pursuit of starting a residency, if that's something you so feel called to do. So I've listed up here our goals. Within our residency at Cahaba, our program goals are to equip, educate, inspire, cultivate, and support through this first year. So I wanted to leave you with this thought, as you can see the phrase up there of someone questioning whether this thing called medicine is their calling, or this thing called being a nurse practitioner is their calling. I can't help but think how many well-qualified, passionate, mission-minded advanced practice providers could have had the equipping, the support, the inspiration, and the cultivation. If they could have had this, how many more would still be in this workforce, would still be faithfully serving communities, whether in FQHCs or not, but particularly within FQHCs, living out their calling, walking both in Christ and being his hands and feet, walking in him, making healthcare, equity, and justice a more close reality. How many more would be able to do those things if there was a proper place that could educate, inspire, and support? It's just a thought that I wanted to leave you guys with today. So here's some references. All my references, you're welcome to reach out if you would like a list or like my slides by any means. So, but I hope this was helpful today to briefly identify the need as well as the benefit of nurse practitioner residencies. Please reach out to me with any questions at all. I really appreciate you watching this presentation, and I very much appreciate your interest in training advanced practice providers. I hope blessings and life for you. Again, thank you so much for spending some time with me. Y'all have a great day, guys. Again, thanks again.